Hi, my name is Bernadette Correa, and today I want to talk about nutrition-related disparities in transgender health. I want to start by summarizing a scoping review done by Rosga and colleagues just last year in 2020. They looked at original research from 1999 to 2019 that examined nutrition-related health outcomes in transgender people. 189 studies were included, and through the analysis of 5 subtopics, they took the first steps in providing evidence-based care for the nutritional health of transgender people. For each sub-question, Rosga and colleagues addressed the extent, range, and nature of literature pertaining to one of the 5 subtopics. Sub-question 1 addressed dietary intake and included topics such as alcohol consumption, nutrient intake, specific foods and food groups, micro and macronutrients, and nutrition-related behaviors such as skipping breakfast. Sub-question 2 addressed nutrition-related health disparities in transgender individuals compared to non-transgender individuals. Malnutrition, obesity, overweight and underweight, alcohol abuse, diabetes, and eating disorders were among the most frequently reported nutrition-related health disparities. Sub-question 3 addressed reliability and validity of nutrition assessment methods, and sub-question 4 addressed the effect of nutrition interventions on nutrition-related outcomes. Both sub-questions 3 and 4 show that very few studies report on nutrition assessments and interventions within the transgender population and will be excluded for the purposes of this discussion. Sub-question 5 addressed the effects of hormone therapy on nutrition-related health outcomes. Studies were reviewed and categorized by hormone therapy status, feminizing, masculinizing, or puberty-blocking hormone therapies. Researchers found that studies of adults on feminizing or masculinizing therapy mostly reported on anthropometric measures, so body measurements, lipid profiles, and bone density, and long-term effects related primarily to cardiovascular health, cancer, and mortality. While some research has been done on the nutrition-related health outcomes of hormone therapy, there remains a need for research on effective methods of implementing nutrition therapy for professionals working with transgender clients. More primary research is needed to inform evidence-based clinical nutrition treatment in this population. 2 studies we will discuss further fill some of these gaps. In 2014, Van Kim and colleagues conducted research with United States college students, and their findings specifically addressed sub-questions 1 and 2, dietary intake and nutrition-related health disparities. Also in 2014, Vilas and colleagues conducted a study among various age groups in the Gender Disorder Unit at the Ramon y Cajal Hospital in Madrid, Spain. Their findings addressed sub-questions 1, 2, and 5, dietary intake, nutrition disparities, and hormone therapy. Let's focus now on dietary intake. Rosga and colleagues do not specify physical activity as a nutrition-related behavior. They do specify caloric intake as pertaining to sub-question 1, and caloric intake and weight are related, so for our purposes, and following suit with Van Kim and colleagues, physical activity is included here under dietary intake. Screen time is also included for similar reasons. As you can see here, psychosocial changes have an impact on food consumption. This is a pattern you will start to recognize throughout this discussion. In Spain, it was found that participants consumed an unbalanced diet, high in fat, cholesterol, and sodium. Both studies found that transgender individuals participate in limited physical activity. Here on the right, you can see the differences in activity of male to female and female to male groups. And on the left, you can see a comparison of transgender and non-transgender individuals when it comes to physical activity and screen time participation. Moving on to sub-question 2, related to nutrition-related health disparities of transgender individuals compared to cisgender individuals. You can see here on the left that transgender people are more likely to be underweight or obese. According to Vilas and colleagues, the combination of hormone therapy and lifestyle habits lead this population to an increase in body fat. Van Kim and colleagues found that an increase in obesity prevalence makes transgender people susceptible to chronic diseases such as cardiovascular disease. They also found that nutrient intake makes this population especially susceptible to chronic diseases and therefore presented with cardiovascular risk factors, such as high intake of lipids, cholesterol, saturated fatty acids, and sodiums. Lifestyle habits such as eating breakfast, physical activity, a balanced diet, and less screen time can help transgender people decrease these adverse health outcomes, and this is where interventions come in. Specifically, nutrition and education courses should be included in a comprehensive treatment program for transgender individuals. Also, among college students, physical activity should be a priority area for intervention, and more targeted interventions may be necessary to alleviate existing disparities and improve long-term health. Moving on to sub-question 5, pertaining to hormone therapies. Together with cross-hormone treatment, dietary habits and lifestyles, so limited physical activity, lead to an increase in body fat. This was especially true for the female to male group, whose overweight and obesity prevalence increased pre to post hormone treatment. 22.72% were overweight or obese pre-treatment compared to 34.85% post-treatment. Oestrogen, which is used in feminizing hormone therapy, has been shown to change body composition with a loss of lean tissue, such as muscle, and a gain in fat mass. The role of androgens, which are used in masculinizing therapy, are less clear. However, dihydrotestosterone, which was used in the Spanish study, has been shown to have no effect on fat distribution. Transgender individuals often have body image issues, and this can cause emotional changes such as becoming introverted, withdrawn, or antisocial. This can make someone feel rejected by others, and these emotional changes can cause dietary disorders, which can explain the increase in overweight and obesity prevalence. In conclusion, transgender people have unique nutritional needs that can vary depending on their stage of social and medical transition, as well as the type of gender-affirming therapy they're undergoing. Social and psychological changes coupled with body image issues lead to a susceptibility of eating disorders in transgender people and people with gender identity disorder or gender dysphoria. Eating behaviors and lifestyle changes can increase the prevalence of obesity and make a transgender person susceptible to chronic disease and cardiovascular disorders. Transgender individuals are more likely than cisgender individuals to be underweight or obese and less likely to meet recommendations for physical activity. Future research should focus on topics such as the impact of medical interventions on weight status and/or body composition, systemic barriers to physical activity, so things like locker room facilities, and dietary intake, dietary patterns, mealtime behaviors, and micronutrient intake. Thank you for watching. I hope you enjoyed, and I hope you were able to learn something new.